My name is Mickey Nashke. I'm from Galveston, Texas. I've had VNS therapy since August 28th, 2000. I'm 38 years old. I was having seizures maybe sometimes 5 or 6 a day. Not every day, but you just never knew when it was going to happen. It could be 2 days out of the week, 3 days out of the week. It was just, I didn't know.
Well, Mickey has been on several medicines, and some of them did make him lethargic. Some made him gain an excessive amount of weight. Others, he just would act normal.
I could really see it affecting me like as a teenager because, for one, I couldn't drive when I was 16, and I had a special account for a car. Parents were kind of scared about having an epileptic at their house, and it was kind of like Friday nights. I never went to parties or anything like that. I was considering brain surgery. My mother wasn't very happy with that. I heard about something new that had come out, and she asked me to wait on the brain surgery and we could see if we could check this out. And it turned out to be VNS therapy. I was implanted with the VNS therapy in 2000, and I've had it for 13 years now, and I've never had a complaint. Before VNS therapy, I was having days where I'd have 10 seizures a day. And when I got my VNS therapy, now I might have once a month.
After the implant, kind of started noticing a change for the better. 2 weeks after, a month, seizures becoming fewer, but of course he still had some. And once the implant, and then found the right combination of medicines to go along with it, really made a lot of difference.
Before I got my VNS, I didn't really have the confidence in doing a lot, but afterwards I got this new confidence in me, and I was able to start doing some traveling to help me in what I do with my business and my love of going to epilepsy conventions. I talk with others about my epilepsy and stuff because I feel, coming from their situation, that hearing it from someone who has it is a lot better than hearing it from someone who doesn't.
What I'm particularly proud of is the amount of pain that he's gone through his whole life with his seizures, and how he could tolerate it and still come through with a good attitude. Of course, now this bicycle ride that he's been doing for 3 years, it kind of gives him a sense of purpose, and it helps him. It does.
Pedal for Purple is a bike ride that we started in Galveston 2 years ago, and we're on our 3rd year. Pedal for Purple is a celebration of life and for epilepsy awareness for me. And it's like a dream come true that I've always wanted to do. I still have seizures, but I just want people to know that your quality of life with the VNS therapy, it outweighs that. I have my days, but it's much better now since, I've gotten the VNS therapy. It really has changed my life.
The VNS therapy system is indicated for use as an adjunctive therapy in reducing the frequency of seizures in adults and adolescents over 12 years of age with partial onset seizures which are refractory to anti-epileptic medications. The VNS therapy system should only be prescribed and monitored by a physician. The VNS therapy system is not a cure for epilepsy, and since seizures may occur unexpectedly, patients should consult with a physician before engaging in unsupervised activities. The safety and efficacy of the VNS therapy system has not been established for use during pregnancy. Patients who smoke may have an increased risk of laryngeal irritation. The most commonly reported side effects from stimulation include hoarseness, prickling feeling in the skin, shortness of breath, sore throat, and increased coughing. These typically occur only during stimulation, are well tolerated, and noticed less as time goes on. The most commonly reported side effect from the implant procedure is infection. This summary represents partial excerpts of important prescribing information. The information is not intended to serve as a substitute for a complete and thorough understanding of the VNS therapy system, nor does this information represent full disclosure of all pertinent information concerning the use of this product. Full prescribing information can be obtained at www.cyberonics.com/manuals.